While the 140 million Singapore dollar worth of COVID-19 vaccines that expired in Singapore may be seen as a regrettable loss, it is important to note that the funds were allocated specifically for the purpose of acquiring vaccines to protect public health and the national economy. That being said, if the funds were to be redirected to other areas, it would depend on the priorities and needs of the country. For instance, the funds could be allocated towards improving healthcare infrastructure and services, supporting education and skills training programs, or investing in research and development to promote innovation and growth. Alternatively, the funds could also be channeled towards social welfare programs and initiatives to support vulnerable populations such as the elderly, low-income families, and persons with disabilities. Ultimately, the decision on how to allocate the funds would depend on the priorities and needs of the country and its citizens. It is also important to note that vaccine purchasing is subject to wastage, and the uncertainties surrounding the COVID-19 pandemic made it difficult to accurately predict vaccine needs and uptake. Singapore's wastage rate of 15% is also lower than that of the United States, which wasted over 11% of its COVID-19 vaccine stock. The larger question of whether the 1 billion Singapore dollars spent on vaccine acquisition was a good use of public funds must also be considered. Singapore's successful vaccination campaign has resulted in one of the lowest rates of COVID-19 deaths despite having more than 2 million cases of infections. Without the vaccination campaign, Singapore could have seen an additional 4,000 deaths or more based on experts' analysis. This has not only saved thousands of lives but also prevented potential catastrophic economic and societal impact. Therefore, the 1 billion Singapore dollars spent on vaccine acquisition can be seen as a worthwhile investment in protecting public health and the national economy. While the wastage of vaccines is regrettable, it is justifiable given the uncertainties and risks associated with the COVID-19 pandemic. Thanks for tuning into this response video. If you want to stay up to date on the latest reactions and responses, make sure to subscribe and hit the notification bell. And as always, I love reading your comments and feedback.